My name is Ui Gascon, and as a student at the University of Hawaii Maui College, it will benefit me to interview you as an expert in the field I am pursuing. You are doing what I want to do, and I want to find out about the path you took to success. I will ask you some questions about your background, your education, and your work and career experiences, and the path you took to get where you are, so that way I can learn more about you and get a better insight into the path I want to take for my future. I hope to use this information to manage my path towards a dental career and to become a dental hygienist. This interview should take around 15 to 30 minutes. Do you have time for this interview today?
Yes.
Let me begin by asking you some questions about your educational background and career path in dental hygiene. What was your educational path to becoming a registered dental hygienist?
I first worked as a dental assistant to gain experience in dentistry and patient care. After that, I completed my prerequisite college courses and applied to a dental hygiene program. Once I finished the program, I passed the national board and clinical licensing exams to become a registered dental hygienist.
Which college or program did you attend and why did you choose it?
I attended an accredited dental hygiene program in California that had strong clinical training and high board exam pass rates. I chose this program because of its good reputation and the quality of hands on experience students received.
How competitive was the admissions process?
The admissions process was very competitive because many students apply but only a small number are accepted. Grades in science prerequisite courses were very important, and some programs also required interviews and entrance exams.
What prerequisite or preparation courses helped you the most before entering the program?
Anatomy and physiology helped me the most because understanding the human body is very important in dental hygiene. Microbiology was very helpful for learning about bacteria and infection control.
Are there any courses you recommend I focus on strongly?
I recommend focusing strongly on anatomy, physiology, and microbiology because these courses are heavily used in dental hygiene program. Good study habits in science courses will help you succeed.
What did the clinical portion of your program involve?
The clinical portion involved working on real patients under instructor's supervision. We performed cleanings, took x-rays, and did periodontal charting and provided patient education.
How many clinical hours were required?
The program required several hundred clinical hours, around 600 to 800 hours. These hours include patient treatment, radiographs, and clinical exams.
What was the most challenging part of clinical training?
The most challenging part was learning instrumentation and in managing with patients. It was also challenging to meet clinical requirements and balance clinic with studying.
How did you prepare for the National Board Dental Hygiene Examination and Clinical Licensing Exam?
I use review books, online practice tests, and study with classmates. I study a little every day and focus on practice questions to prepare for the exam format.
What study strategies work best for you?
Flashcards, practice questions, and study groups work best for me. Making a study schedule and reviewing a little each day help me stay organized and prepared.
Now, I would like to find out about your daily work experience as a dental hygienist. What does a typical workday look like for you?
A typical workday for me includes seeing patients for cleanings, taking x-rays, periodontal charting, and educating patients on oral hygiene. I also review medical histories and work with the dentist on treatment plans.
How many patients do you usually see per day?
Most days I see about 6 to 10 patients per day, depending on appointment length and the office schedule.
What procedures do you usually see per day?
Common procedures I see include adult cleanings, periodontal maintenance, x-rays, fluoride treatments, and periodontal charting.
How much autonomy do you have in patient care decisions?
I have a good amount of autonomy with cleaning, charting, and patient education, but I still work under the supervision supervision of a dentist and discuss treatment plans together.
How closely do you collaborate with the dentist?
I collaborate closely with the dentist, especially when diagnosing periodontal disease and planning treatment. Good communication between the dentist and I are very important.
What type of practice do you work in? Is it public, corporate, private, specialty?
I work in a general dentist office.
How does the setting impact your daily responsibilities?
In private practice, the schedule is more relaxed and patient relationships are long term.
What documentation and charting responsibilities are expected for you?
I'm responsible for periodontal charting, updating medical histories, documenting procedures, and writing clinical notes in the patient chart.
Next, I would like to ask you some questions about the skills and qualities needed to succeed in this profession. What technical skills are more important for a dental hygienist to master?
Instrumentation and scaling skills are the most important technical skills. Taking accurate x rays and periodontal charting are also very important skills.
How long did it take you to feel confident in your instrumentation skills?
It took me about a year or more after graduating to feel fully confident. Confidence comes with practice and experience.
What interpersonal or communication skills are most important in this role?
Communication and patient education skills are very important. Explaining procedures on oral hygiene instructions clearly and calmly.
How do you handle anxious or difficult patients?
I speak calmly, explain everything before starting, and check on the patient often. Building trust helps patients feel more comfortable.
What makes this career challenging?
The, work, the career can be physically demanding and sometimes stressful, with time management and difficult patients.
Are there physical demands I should prepare for?
Yes, dental hygiene can be hard on the neck, back, shoulders, and hands, so good posture and ergonomics are very important.
What makes this career rewarding?
Helping patients improve their oral health and build long term relationships with patients make this career very rewarding.
What continuing education or certifications are important for long term success?
Continuing education is required to maintain a license. Certifications like local anesthesia, laser therapy, and periodontal therapy can help with career growth.
Finally, I would like to ask you some questions and advice as someone currently preparing into this field. What advice would you give to someone transitioning from dental assisting into dental hygiene?
Build string, time management, and study habits sharpen your patient communication skills, and be ready to shift from assisting tasks to taking full responsibility for patient care and clinical decision.
What is one thing that you wish you had known before entering the dental hygiene program?
I wish I had known how much emphasis there is on patient education and preventative care, not just clinical skills.
Are there common mistakes students make during the program that I should avoid?
Yes, many students underestimate time management, procrastination on studying, and struggle with balancing clinical responsibility with coursework.
What resources, organizations, or mentors would you recommend for someone pursuing this career?
I recommend joining the American Dental Hygiene Association, seeking out experienced hygienist mentors, and using school resources like study groups and clinical lab to build skills and confidence.
May I follow up with you in the future if I have any additional questions?
Absolutely. You can follow up anytime with more questions, and I'll help you with the guidance and advice.
Well, it has been a pleasure finding out more about you and your experiences and professional insights. Is there anything else you would like to share with me today?
Not at the moment.
I appreciate your time for interviewing with me today. Do you have any questions for me?
No questions. I wish you the best of luck on your journey.
I have gathered some great information today that will help me in my future career. Would it be all right to reach out to you via phone or email if I have any more questions?
Absolutely.
Thank you for your time.